the parent pay option has been not only beneficial for us as an employer, but beneficial for the child and the parent as well, because that consistent oversight of your child can be helpful. Hi, guys. Welcome to Pivot and Profit with Priscilla. Today, I want to talk to you guys about structured family pay, or what I like to call parent pay. In Georgia, the government has now allowed providers that work in the Georgia Pediatric program to pay parents for unskilled hours. So, let me discuss a little bit what unskilled hours means. So, with my clients, we when we apply for the program, the physician recommends skilled and unskilled hours, or skilled or unskilled hours. Sometimes you can get both, sometimes you get one or the other. Skilled hours just mean that the laborer or the worker has to have a license to do the work. So, skilled workers are LPNs, licensed practical nurses, or RNs, registered nurses. They're nurses with state board certified licensing. Unskilled hours basically means that you either have a certification or you just have experience in the arena. CNAs, certified nursing assistants, are certified by the state of Georgia. PCAs, personal care assistants, they take a test in order to be certified by the agency, or some call them homemakers, and they're just people that have some experience in home care. So, right now, the government has stated that parents or anyone in the home over the age of 18 are allowed to work those unskilled hours. Again, unskilled meaning you do not have to have a license from the state to do the work. So, prior to this ruling, which happened permanently last year in March 2024, it became permanent. When COVID started, the state kind of played with the idea. They let us do it, and then they kept saying they were going to end it. It just never ended, but they never gave a definitive, yes, this is going to happen. I know in other states, they do allow it, and it has been permanent for a while. So Georgia has come on board and made it permanent. Prior to this ruling, we had to hire CNAs, PCAs, or homemakers. The biggest issue was that in this program, the reimbursement rate for unskilled hours it's low. Back then, the rate was $20 an hour. $20 an hour reimbursement may seem like a lot to some, but as an employer, you have to factor in certain things. One, the state of Georgia does not allow you to hire an unskilled worker as a contractor. So let me explain. There's contractors. You can hire people as 1099 contractors, or you can hire them as W 2 employees. A 1099 contractor is basically someone that you don't have to give direction to. They understand their field, they're bringing their own tools, they set their own hours. They are not an employee. They basically work for themselves, they pay their own taxes. Nurses, which are skilled workers with licensure from the state, can be hired as 1099 contractors. I don't have to pay taxes for them. I don't have to pay for workers' comp for them. Those are expenses that employers have for employees. A W 2, now I can hire them as W 2 employees. However, sometimes when you're starting out, it's hard to give benefits and pay taxes and things like that when you're just starting in a business. So if you can hire somebody as a 1099 contractor, sometimes it saves you money. So W 2 employees, which unskilled laborers have to be hired as. So when you get a paycheck, you pay taxes on your paycheck. What some people don't realize is that the employer pays the same amount of taxes. You basically split those taxes. So if your check was $500 and they took out $150 in taxes, your employer also paid $150 in taxes. You play into the unemployment system. Your employer pays into the unemployment system for you as well. We also have to have workers' comp, which basically covers you if you get hurt on the job. Those can become large expenses. So when the reimbursement rate is $20 an hour and I have to pay you a livable wage, which back in 2020, a lot of the wages for CNAs was around 12 to $15 an hour. Again, that's not a high wage. It's actually low. But let's say I pay you $15 an hour. I have $5 an hour left to cover taxes, to cover workers' comp, to cover my RN who has to come out twice a month because Medicaid does not reimburse for my RN to come out twice a month and do supervisory visits, but it is required. An RN carries a much higher hourly wage right now, which is probably somewhere around $40 to $60 an hour. But I have those expenses to cover with that $5 an hour that's left over. And then I hope to make a profit. So when it came to hiring unskilled workers, it was hard because one, if I paid you a higher wage, I didn't earn a profit. If I pay you a lower wage, nobody stuck around. So there were times when we'd have CNAs that would take the job and wouldn't show up for the first day at work. I remember when I was in senior care, I got my first client and I was so excited. And this was when I had the senior agency. I was so excited. And on the day that I started, the CNA, the caregiver didn't answer the phone. Luckily, the client had unskilled hours. So I became the laborer. I went in, I kept the client, I cleaned her house, I cleaned her toilet, I made her food. I worked for my first client until I was able to hire somebody else that would do the work. Now, had that been a skilled hours, I wouldn't have been able to do that, but we pay the skilled laborers more. So with the unskilled hours, it was sometimes hard to keep employees because the wages were low and the reimbursement rates were also lower. So recently, the state has increased the reimbursement rates to $26, around $26 an hour now. So $6 more. I still think the reimbursement rates are low, especially at this day and time. But we can now increase what we're paying our unskilled laborers. So right now with the parent pay, the state has allowed us to pay parents for those hours. What that means with the state, because remember I said you have to be hired as an employee. So we have to hire our parents or whoever's going to work the hours as an employee of ours. That means they have to fill out an application. In order to work for us, you also have to have a fingerprint background check, which right now the state charges around $50 to $60 for. We cover that cost. You have to pass the federal fingerprint background check. You have to have a TB test. You have to have a CPR certification. That CPR certification cannot be an online CPR class. It has to be an in-person CPR class. We have to pay for unemployment. We have to pay for workers' comp. So the parent basically becomes our employee, and we're able to pay the parent for those hours. This has helped because it's helped keep some consistency in the business. Um, Parents are happy to do it. Most of them are already taking care of their children anyway, and some of this equates to extra money in the household for them. It allows them to stay home with the child and not have to work all day and be gone. They're earning a paycheck and they're if you have nursing hours, you're also kind of getting to work with the nurse on the care of your child and work with our agency, which comes with its own benefits. We provide supervision for the parents. The nurse is coming in twice a week and making suggestions. They're doing those supervisory visits, twice a month. And the nurse is coming in looking at the overall health of the child. They're not just doing the supervisory visit on the parent, but she's also able to do an assessment on the child twice a month and make suggestions. So the parent pay option has been not only beneficial for us as an employer, but beneficial for the child and the parent as well, because that consistent oversight of your child can be helpful. And us working with the parent and the physician and the child just help create overall consistency in the healthcare of the child. So I think this has been a great tool. It was implemented to During COVID, like I said, to just cut down on the amount of people that were entering the home. Imagine if you have skilled hours and you have 84 hours a week. 84 hours a week cannot be completed by one nurse. You have to have at least 2 to 3 nurses to complete those hours. Now imagine if you also have the 40 hours a week of unskilled labor. So now that's 3 to 4 people that are entering your home on a regular basis throughout the week. Plus, you have my nurse coming in doing supervisory visits twice a month or once a month for the nurses. So this structure was implemented basically during COVID just to cut down on the amount of people that are coming in the home. And again, parents love it. And I completely understand why. When you have a medically fragile child that you're responsible for, and it doesn't allow you to work a regular job, it doesn't allow you to go to school for regular hours, it can be very beneficial for somebody to give you some type of financial assistance to help lessen that burden. I think parent pay has been great. And I'm glad the state implemented it permanently. So here's some of the challenges that I foresee in the future. I have seen that the regulations surrounding unskilled hours are getting more stringent. I do believe that the government has realized that there are a lot more parents signing their children up for services now in order to utilize the parent pay and bring on some extra income. So for us, recently, we have quarterly calls with the state, and I have seen that the rules are getting a lot more stricter. The oversight seems to be, there seems to be changes coming as far as the oversight is concerned. The supervisory visits, um, we're having to provide more information. We're having to give the government just a lot more paperwork sometimes when it comes to these parent pay hours. So I do foresee that getting a lot more stricter for providers. I also have some concerns. I have concerns around hiring employees, concerns when it comes to unemployment, because now you do have an employee. And if the state cuts those hours, is that employee going to be able to file for unemployment? I do think that what workers do not understand about unemployment, and for a long time, I've been wanting to have this conversation because as a worker, I would always say, why does my job want to deny my unemployment? That doesn't make sense. I pay into the system. I should be able to get that money back out. What you don't realize until you become a business owner is that, again, the employee pays into the system, but the employer also pays into the system. And the system sets a percentage of what you have to pay. That percentage is usually low until you start to get a lot of unemployment cases that are approved. It's basically like having car insurance. So your car insurance rate might be low until you get a ticket or until you have an accident that's deemed your fault. And then your car insurance rate goes up. Same thing happens for employers with unemployment. When you start getting a lot of unemployment claims, or if you get an unemployment claim that is approved for that worker, we get penalized. So our rate for unemployment increases. This is why employers fight your approval for unemployment. So for me, my concern is, if the government makes a decision to lower that child's hours because the child is getting better and doesn't need as many hours, am I now going to be liable for lowering the hours of my employee, which then allows them to get unemployment, which in turn increases my unemployment rate? So, those are just some things that I have concerns about. There are other things that I am also concerned about that I plan to detail and provide to the viewers through my newsletter and through other resources. Again, I do think this is a good thing. I think it's a good thing for the system, but I think as employers, we have to make sure that we are protecting ourselves at all times as well. I want to know what you guys think. And I also want you to click down below and sign up for our newsletter. I'm going to be offering some tips to employers on what to look out for when you hire employees, some of the ways that you can cut your expenses, but also pay a livable wage and protect your company as well. Thank you guys so much for watching and have a good day.